Tom, it's 8:15 now, and baby boomers and long-term care. It's a critical issue as more and more people reach retirement age. And this morning, Ron Goldner of Wealth Strategies Group is here to talk about long-term awareness. And when should people start thinking about, first of all, what is long-term care?
Long-term care is an insurance coverage for folks that have a disability or just due to illness and have to be tied up either at home or in a nursing facility.
Why can't we count on, like, say, Medicare to take care of?
Medicare is not was never intended for that type of coverage. Medicare is basically used for acute illness. Once you're well and could be taken out of the hospital and to convalesce, then you're on your own.
Okay. And as a practical matter, how does this work in families? We know that women live longer than men, so it's mostly for women?
Well, it's not mostly for women, but women are generally the care providers, and about 60% of the non-paid care providers are women, whether it's the spouse or the adult daughter. And what ends up happening is that the woman takes care of their spouse, and then after so many years, they've spent down all of their assets, and then when it's time to take care of them, there's nothing to provide for them.
Yeah, you were given the example during the break of, say, a spouse in a nursing home.
Mm-hmm. Well, it could be either a nursing home or at home.
Right. But you're caring for one.
You're caring for one, and in order for you to be able to provide for them, you have to take off from work, especially if it's an adult daughter. You have to be able to take off from work, and you're no longer earning an income. But the care, generally, especially in the Mid-South right now, you're looking at anywhere from $175 to $180 per day.
Yeah, and you could get wiped out. When does this long-term insurance kick in? Is it after that period or during?
No. The whole idea of this is so that it takes care of you right at the very onset of an illness, when you're brought home from the hospital, or if you're disabled, you have to remain at home. And so therefore this kicks in right away. Okay. Generally, there are certain elimination periods like any other type of insurance.
Sure.
But the whole idea behind long-term care is to protect the assets.
Yeah.
Because unlike life insurance, where it protects a family if a wage earner is deceased before the family grows up, once you get to that point, long-term care provides for the surviving spouse so that they are not left destitute.
Okay. Ron, let me just ask you, can you go to your insurance agent and ask about this long-term care? Everybody pretty much have it?
Yeah, and the idea is to make sure that you shop around, because first of all, you need to look at it when you're generally in your late 40s, early 50s, because it's health related.
Right.
The healthier you are, the lower the cost it's going to be.
All right.
And also the type of services are more available to you when you're younger.
Okay, Ron Goldner of Wealth Strategies Group here talking about an important issue. And
I'd also like to make an offer. The Women's Guide to Long-Term Care Health Insurance, which is provided by the American Association of Long-Term Care. If you call my office, we'll send this out to you.
Okay. I don't know if we have your number up, but call Ron's office at...
It's 473-9000.
473-9000. All right, thank you, sir. We're out of time. We got to go. We'll be right back. Good Morning Memphis on Clock 13. 473-9000. All right.